Hello, and welcome to the Social Protection Podcast. I'm your host, Jo Sharp. This month, we're kicking off a special 3-part series looking at emerging trends for social protection in the Indo-Pacific. In this first episode, we're talking about how social protection is evolving in the Pacific region and in Fiji and Kiribati in particular, 2 Pacific Island countries that are growing their social protection coverage. It's a region we haven't featured much on this podcast, but there's a lot to learn. We'll talk about how Kiribati finances its schemes from its sovereign wealth fund, Fiji's long journey in shock-responsive social protection as it looks ahead towards anticipatory action, and how programs interact with traditional systems, values, and the Pacific Way. With me for today's episode, we have Varemo Muria, who is a Director at the Department of Social Welfare in Fiji, Shirin Gul, Technical Specialist on Social Protection for the Women, Youth, Sport and Social Affairs Ministry in Kiribati, and Karishma Huda, who is Team Leader for the Partnerships for Social Protection Program, or P4SP. Welcome, Director Varemo, Shirin and Karishma.
Joe, it's nice to be here. Thank you for the invitation.
Maori, everyone. Thank you so much for having me on the podcast, Jo.
Thanks so much, Jo. Really excited to be here today.
Karishma, can I come to you first for an overview? The Pacific is, of course, a very large and diverse region, so we're not to generalise. But what are some of the patterns or trends we can observe in how Pacific Island countries have developed their social protection systems?
Thanks, Jo. So when we look at the social protection landscape across the Pacific, we can see an investment trend that initially focused on supporting formal workers through provident funds, and then a gradual rollout of tax finance social protection programs, mainly for the elderly, people with a disability, and for the unemployed a few decades later. So social protection systems in the Pacific region have been evolving from around the time they gained independence to now, gradually expanding in scope and coverage and prioritizing lifecycle groups that societies considered to be the most vulnerable, particularly the elderly and people with disabilities. Governments have been investing in social protection for nearly 5 to 6 decades now, ensuring support to those who need it most. And some countries, like the Cook Islands, have well-established systems that cover nearly the entire population across all vulnerable life stages. So social protection investment is not new to the Pacific region. Interestingly, the source of social protection financing for each country also influences the landscape in these countries. Sovereign wealth funds, for instance, have been emerging over the past decade as a way of managing the revenues from natural resources in order to improve human development outcomes in their countries. Kiribati is an excellent example of how the revenues from the Revenue Equalization Reserve Fund, which was established as a result of phosphate mining royalties, have been used to create a comprehensive and equitable social protection system. Because this wealth is generated from natural resources, the government of Kiribati prioritizes the redistribution of these funds in a way that benefits society more broadly. It comes from a public good, so the idea is that everyone should benefit. Other countries also leverage sovereign wealth funds from other natural resources, such as tuna fish licensing, oil reserves, among others. So it's not incidental that Pacific Island countries that invest significantly in social protection and universal social protection programs do so through financing from these sovereign wealth funds. Countries without sovereign wealth funds are not able to allocate the same level of expenditure. So in these countries, social protection systems are financed through a mix of tax revenues and overseas development assistance. So basically, international aid or concessional loans from development partners. As a result, the landscape in these countries can look a little different. In Fiji and Tonga, for instance, we see that there is a combination of broad-based lifecycle programs like social pensions for the elderly and disability benefits, like much of the region. But they also have programs designed for the poorest or programs with conditionalities attached. And these have been shaped together with the support from development partners.
Thank you, Karishma. Coming to you now, Director Varemo. Fiji was one of the first countries in the entire Asia-Pacific region to have launched a social assistance program with its Family Assistance Allowance, which was introduced in the 1920s. And that's now evolved into a scheme called the Poverty Benefits Scheme. The Family Assistance Scheme is, I think, its current name. Fiji has also been steadily building its system to cover more categories or groups of people, including a social pension for the elderly, a disability benefit, care and protection allowance for vulnerable children, and others. Why do you think Fiji's system has evolved in this way? What has been the intention or the reasoning for this sort of layering of programs?
Thank you, Joe. I believe we all strive for progress, any involvement in terms of moving forward and to progress in life. So over the years, government social assistance program has evolved with the recognition of the different needs of the poor and the vulnerable in our countries. So government prioritized the different needs by providing targeted assistance to the different groups. In the past 5 years, the ministry continues to witness an increase in the number of individuals and households coming into the system. And as a result, we increased the budgetary allocations and the budgetary pressure as well, and the ministry's capacity to deliver these programs. Fiji has seen social assistance expenditure increase nearly triple over the last decade, with the biggest increase happening in the last 5 years. So in 2013, Fiji spent 0.4% of the GDP on its 4 main social assistance schemes. But by 2018, this expenditure doubled to 0.8% of GDP. In terms of the philosophy and the intention, Joe, I believe the vision for the Fijian government is to promote the progressive realization of the universal right to social protection to reduce poverty and social exclusion, particularly across the life cycle, with a focus on elderly, people with disabilities, and the vulnerable children. The focus from just the provision of social protection program to a more planned, programmatic approach towards prevention, new innovation, and most importantly, graduating welfare to workfare. So this social protection program is also targeted and adaptable social assistance program, protecting the poor and the vulnerable against shocks, including those from climate-related disasters, promoting security and building resilience so that Fijians are able to fully participate economically, socially, and culturally in society.
Shirin, you work in Kiribati, which is a country in the Central Pacific of about 119,000 people living on 20 inhabited islands, so small and spread out. Kiribati is one of the countries that has significantly expanded its social protection programs in recent years, a bit like we've just heard from Fiji. What has driven the expansion in the case of Kiribati?
Thanks so much, Joe. The experience in Kiribati, it does resonate with what both Karishma and Director Virimo have already talked about, which is that it started with the Provident Fund and expanded into an old age benefit, which came around 2004, which at that time was modest. Then also came about the disability benefit, another universal benefit. This was around 2018. And now, as you said, an even more broad-based program, which is the unemployment benefit or the support fund for the unemployed, which came about in 2020. As such, if you look at it with two universal programs and unemployment benefit, the whole system is a broad-based system, and it is framed within a life cycle inclusive social protection approach. The impetus for the programming has been very country-driven and country-led. And of course, when it's country-driven and country-led, that means that there is great political support. And what we talked about often in terms of political will, you can see it in action in Kiribati. And not only is there political will, in fact, in my observation, social protection remains a bipartisan issue within Kiribati. And I'll give you what I think is a very clear demonstration of that, which is the passing of the Senior Citizen Allowance Act in 2020, which was unanimously passed by the Parliament. And in the previous election, both the current government as well as the current opposition had within their campaign promises a new broad-based social protection benefit. The contours obviously differed, but they both had that within their campaigns, and therefore this was very prominent on the development agenda because both parties pursued it.
Shirin, just to stay with you for a minute, I wanted to ask you a little bit more about the support fund for the unemployed. Kiribati is the only Pacific Island country with a broad-based unemployment benefit, and they're not particularly common in the region more broadly. Why has this particular benefit been such a priority? And do we know anything about the impact of having this benefit available in the system?
In my opinion, obviously the impetus remains that political consensus push the government to keep it as a policy priority. I think that's one thing. And the other, I think, is just the kind of impact and results that have also come in. And we've had some assessments in the last year or so by different development partners, and they very clearly show the positive impact, and specifically on women, as that with unpaid care, a lot of women are left outside the labor force in many countries, in Kiribati as well. With this, what has happened is that those women have been, in a way, economically included, if you will. And these assessments have shown that these women are now able to actually access some savings with the money that they're given. And with those savings, they are spending it on their children's health and education, mostly. Some have also started a very small micro enterprise, I'd say. Even more importantly, when Director Virama was talking about the Pacific way of life, and community plays a very significant role in that. What has been noted with some of these assessments, and one of them was specifically a gender assessment, is that women are able to contribute more fully in communal activities. And that has contributed to their improved participation in community and public life, as well as some degree of their role and their decision-making within their families. So I think these are very important aspects which are in line with the policy intent of the government, which does take the Kiribati way of life as the center of policymaking on all avenues, including social protection. Often we do read and we do hear discussions which talk about market distortions and disincentive for work. And in the case of Kiribati, I think the important thing to note is that the current benefit level is around 22% of the legal minimum wage. So it really doesn't create much of a disincentive. What one would, however, emphasize is that whereas the SFU is a very important response to lack of economic inclusion for youth and for women, it cannot be the only response. So the SFU may be a starting point, but there are many supply-side responses which are needed.
Karishma, I'll come back to you. We've just started to talk about some of the impacts of the unemployment benefit in Kiribati. What do we know about the impacts of social protection programs in other Pacific Island countries?
So in terms of assessing the impacts of formal social protection programs, there have been relatively few rigorous impact evaluations or assessments done as compared with other regions. Most of the evaluations of programs have been following disasters, such as the post-disaster assistance in Fiji and Tonga, which were conducted by the World Bank with Australian support. What we know from these studies is that most of these transfers were spent on food consumption. Other uses of transfers included healthcare spending, as well as school bills and fees. And in the context of shock response, households that received top-up transfers through existing social protection programs were much quicker to recover from these cyclones as compared to those that didn't receive these transfers. And this is because the cash helped them avoid negative coping mechanisms like taking their children out of school or selling off productive assets. We also know from other regions that these programs can have positive impacts for the broader economy, which stem from the multiplier effects and how these transfers are spent. And there is currently research being carried out in Samoa and Kiribati to estimate what the scale of these effects might actually be in the Pacific context.
Director Virama, we've started to touch on shock responsive social protection there, and Fiji has been on a real journey itself with shock responsive and adaptive social protection. How does Fiji use its established social protection programs to respond to shocks like cyclones, also during the COVID period?
Thank you, Joe. I believe T.C. Winston is the first Category 5 cyclone to directly strike Fiji, which completely wiped out a huge chunk of our GDP. We are still trying to recover from the impact, and we are building back stronger as a nation with the assistance of our development partners. But in terms of responding using our social protection system, the government swiftly mobilized funds through its existing social protection programs to channel cash assistance to poor households and vulnerable groups. Households that are covered under the Poverty Benefit Scheme, Social Pension Scheme, and the Can Protection Allowance were provided with top-up payment equivalent to 3 months of their regular benefits, which was designed to help them meet their basic needs. But we still faced a lot of challenges in terms of shock response and adaptation. The timely response, because we managed to push the cash out 4 weeks after the disaster. So this is something that Fiji is currently working on to make it more accessible prior to any disaster. So it's a work in progress. So when it comes to COVID-19, in an effort to curb the poverty impact of the COVID-19 pandemic, the ministry introduced top-ups to the existing cash benefits. So in 2020, responding to the dual crisis, the ministry, with financial support from DFAT, had announced the provision of further top-ups for recipients of the PBS at that time, CP allowance, social protection allowance, and disability allowance, using cash-based transfers and paper voucher protocol in August and September 2020. This is all in addition to the existing cash entitlement that they are receiving. So starting August 5th, beneficiaries have been able to withdraw cash from their bank account or redeem the vouchers at their nearest post office. But the challenges is the same in terms of Tropical Cyclone Winston and COVID-19. It goes back to our communication strategies, how we can reach out to people, and also the COVID restrictions that put a lot of restrictions on movement. And therefore, we made arrangement with authorities so that the vulnerables can have access to food, basic food items, and also their money, so that they have enough to sustain them when the borders are closed.
Karishma, during the early COVID period, we saw an increase in the use of cash transfers and the expansion of social protection programs globally. Did COVID similarly drive change in the Pacific region in some of the other countries?
Thanks, Joe. During COVID, the Pacific region saw a big push in social protection expenditure, just like the rest of the world. But even though case numbers were generally much lower in the Pacific, the socioeconomic effects from the crisis were severe and continue to be felt, particularly in those countries that were most heavily reliant on tourism-based revenue, such as Fiji, Palau, Samoa, and Vanuatu. In terms of responses, several countries in the Pacific leveraged their existing social protection programs and systems to respond to the crisis, as Director Veremo just described. And as to be expected, the elderly and people with disabilities were the most widely supported through top-ups to their benefits. But we also saw countries innovate and reach new populations by creating new programs that benefited everyone. Samoa, for example, implemented a one-time universal cash benefit for everyone who signed up for a national ID. And Tuvalu also set up a temporary universal basic income scheme for all citizens. Social insurance also featured pretty heavily in the region's COVID response. So several countries such as Fiji, PNG, Solomon Islands allowed early withdrawals of the provident funds and pension schemes to help people deal with this economic shock. And on the labor market side, Tonga and Vanuatu offered wage subsidy programs, and we saw that Nauru and Palau introduced public work schemes. We see that governments leveraged a range of social protection instruments, but we also saw that humanitarian assistance provided through NGOs were critical in introducing innovative approaches and providing support to hard-to-reach populations quickly. That government NGO collaboration was also quite prominent. COVID also saw a massive wave of ODA flows directed towards social protection, which scaled at really high magnitude between 2019 and 2021. So while aid has always played an important role in the Pacific, it hasn't always been used to finance social protection expenditure, but this shifted pretty rapidly during COVID, with the Australian government budget support financing social protection transfers in Fiji, Timor-Leste, and Tonga, and supported social protection reforms in many other Pacific Island countries, and significant support from ADB and the World Bank to countries in the region as well. Overall, I'd say that although COVID wasn't a catalyst to social protection development in the region, it did introduce opportunities to stress test their enrollment and payment systems and come up with innovative solutions. Fiji, for example, enabled registrations and payments through mobile phones. This was a really useful innovation that stuck and is now part of the social protection delivery system there. So like the rest of the world, I think COVID could be seen as a tipping point for social protection strengthening in the region.
Shirin, Kiribati invests a significant proportion of its GNI into social protection. It's grown from less than 1% in 2019 to a high of 12% in 2021, although I understand that's come down to something around 8% now. And as we've heard from Karishma, Kiribati finances this investment through its sovereign wealth fund. Are there concerns about the sustainability of this level of spending?
Yes, there are conversations around that. And, as somebody who's seeing the results on ground, I think I often turn the question on its head and ask, is not investing in social protection sustainable for Kiribati? And I think that's an important question to answer, because the simple answer in the short to medium term, I would say no, it's not. Kiribati has a long-term 20-year vision, the KB20, and it includes many investment projects, very thought out and very good investments. Now, the question is that there is still some time till those mega projects and investments mature. But as I mentioned, communities are at the heart of the Kiribati way of life, the Pacific way of life, and the government is cognizant that it needs to keep investing in the communities. And social protection is an important strategic policy tool to do that. And in fact, in the ILO's policy review, businesses were shared that there has been on the consumption side a positive impact of social protection reforms since 2020. So this social protection spending that we see is actually an important investment. It's an investment in individuals, in communities, and most importantly, it is investment that generates important economic activity across the economy. And therefore, it is actually very important if the plans and projects and investments planned under the KB20 have to be sustainable.
Director Vremo, coming back to you, I'm just really interested to hear from you about why Fiji does prioritise this expenditure on social protection amidst what I'm sure are a range of competing priorities.
Thank you, Joe. With the last election and the change in government, a physical review was conducted and recommendations were made by the committee to government in terms of social protection. So as a result, there is a consensus across government for a reform on social protection programs with technical support from the Australian government through the P4SP team and the World Bank. So through this reform, there is a recommendations from the committee that there is a need for government to better understand poverty, where it is, who it affects, so that limited government resources can be better directed at addressing it. So in this reform process, the Department of Social Welfare aims to update business processes, standard operating procedures of social assistance programs. Even there is a need to improve targeting, which resulted in the formulation of the social assistance policy, which was approved by Cabinet with a new PMT model based on the latest household income and expenditure survey of 2019 and 2020. There's also a need to create an integrated beneficiary registry by upgrading and harmonizing management information system, MIS, for social assistance programs. Last but not the least, the whole of government consolidated efforts for an adaptive social protection strategy to provide a clear policy in response to shocks such as natural disasters or the COVID-19 crisis, and to build resilience of the poor and vulnerable groups, including women and youth. It's also improving tax relief and associated support. All our social protection programs' monthly cash transfers were topped up by 15% as of the fiscal budget of 2023 and 2024. So despite the fact that there's a lot of competition and a lot of priorities when it comes to budget, the Fijian government still prioritizes expenditure on social protection because of its commitment to the poor and the vulnerables of our nation as a whole.
Karishma, Pacific Island countries are, of course, highly prone to climate-related disasters and shocks of increasing intensity and frequency. Has that been a bit of a driver? Are some countries thinking about building their social protection systems with a view to climate adaptation or mitigation?
Thanks, Joe. So the Australian Pacific Climate Partnership Program published a really great paper just on this topic, and it really emphasized the importance of acting early. So early warning systems and pre-hazard insurance payouts, for example, can potentially have greater economic benefits as compared to post-disaster response. And there are several innovative examples of this across the Pacific Island countries. For example, the study points out how women are often the first responders to disasters in the Pacific, and their role is critical in terms of communicating and passing on vital early warning information to their communities. Women's weather watch groups and women's early warning systems play a really important role.
in providing early warning to communities in a way that ensures everyone, especially women, get relevant information and in their local languages. So we're seeing Pacific women-led NGOs have developed and implemented innovative and gender transformative models to harness women's strength in times of disaster. Fiji also experimented with a pioneering initiative that involved the implementation of parametric microinsurance. So the microinsurance cover for social welfare beneficiaries was designed to be triggered by wind speed and distance thresholds. During the pilot phase, the World Food Programme covered the premium costs, which per policyholder amounted to 32 Fijian dollars, while the payout amount varied between 30 Fijian dollars to 400 Fijian dollars, depending on the wind speed and proximity to the eye of the cyclone. So I guess the point is there are local and innovative approaches that are happening across the region, linking social protection to disaster risk financing strategies and focusing on mitigation rather than just post-disaster response. Knowing that this is an area where development partners stand ready to support governments, it may be some time before we see governments investing toward these mechanisms substantially, but it remains a really useful way to pilot, test, learn, and scale up solutions through government and development partner collaborations.
Director, how is Fiji looking to strengthen its systems for the future, especially to respond to climate change?
Thank you, Joe. I believe Fiji has developed a National Adaptive Social Protection Strategy and implementation plan in 2023. We know that by strengthening our program operations and developing an integrated MIS system that house all of our beneficiaries' data, the Fijian government will be in a stronger position to respond to shocks. So this strategy aims to strengthen the role and the performance of the social protection sector in helping households, communities, civil society, local government, and Fiji overall in preparing for, responding to, and recovering from disasters, and in mitigating the impacts of climate change. We also developed the Fiji First Anticipatory Actions Framework in 2023 that will enable financing to be triggered by the forecast of an approaching hazard instead of only reacting to its impact following the event, as in the case of TC Winston. Our ministry has the responsibility for cash transfer to selected beneficiaries of social protection program and pre-positioning of necessary supplies that is needed even before the disaster. Ministry is working with development partners. We are working on an interoperability system with other government departments. This is in terms of administrative system, social protection system, and disaster risk management system. And all this is done for the better monitoring of beneficiaries and to quickly target potential beneficiaries after shocks.
Thank you. Very exciting to hear about those plans and thinking around anticipatory action. Shirin, you talked about the bipartisan support that social protection enjoys in Kiribati, and I understand the people are going back to the polls this year. Are these programs still popular, and what has the conversation been about them in the lead up to the next general election?
I think largely positive conversations around social protection in the run-up to the elections. There is a recognition that these programs have worked. Obviously, I don't pretend to be a political analyst, but the drive towards broad-based social protection benefits will remain. I think that a broad-based social protection system will not only continue but be further strengthened because it is seen as the people-centered approach to resilience, and you see it time and again in important declarations that the government has made. Specifically, the COP27 presidential speech very clearly talks about these investments as investments into resilience.
Director Veremo, Shirin just started to talk about resilience then, and Pacific Island communities rightly pride themselves on their resilience. Many communities or governments will point to the way that communities share resources to support more vulnerable community members during times of crisis or shock. Sometimes we call these relationships sort of informal social safety nets. I'd just be interested in Fiji. How do you see the formal social protection programs that you're investing in through the government interacting with those more traditional systems within the community?
Thank you, Joe. I believe this is a very relevant question for the Pacific. You may refer to it as informal social safety net, but we see it as the Pacific way. We are very much maintaining our communal lifestyle, and we look out for each other in times of crisis. We share our resources and we support each other even before the assistance from government and donor partners. But in terms of the ministry's program and how it links to these informal social safety nets, the ministry in its implementation of the social protection programs still work with the community leaders in identifying the vulnerable to be assisted and in further verifying the status of continuing beneficiaries. This includes the community traditional leaders in villages and settlements. As a new initiative with the support and the technical assistance from development partners and Ministry of Finance, Jobs for Nature initiatives that assist communities to improve their environment-based projects. So this is a new initiative that connects the formal to the informal social safety net. The ministry's social assistance policy includes collaboration with key stakeholders in the advancements of its social assistance program. The policy also focuses on supporting and advancing gender-responsive social assistance program, ensuring that no one is left behind in the 2030 agenda. And it will be implemented by the Ministry of Women, Children and Social Protection in collaboration with key stakeholders, particularly government ministries, the private sector, faith-based, and civil society organizations. In short, we are resource-rich in the Pacific. So we like to share things and we don't wait for government to come and help us. We take the first step in assisting each other and see who is vulnerable and ensure that we are moving forward together as a nation.
This episode is part of a series on emerging trends in the Indo-Pacific region, and we've talked a lot about how social protection in the Pacific, and particularly in Fiji and Kiribati, is growing and changing today. Where do you see the new frontiers emerging for social protection practice, or perhaps the future for social protection in this region? Director Veremo, let's hear from you first.
Thank you, Joe. I believe we are all gearing towards modernization. So for us, the other areas that we are currently looking at is digital innovation, which is the use of digital platform to deliver efficient and effective social protection services. The second one is gender-sensitive approaches. It is well noted on our social protection reform agenda and designing social protection programs that is inclusive and address the needs and vulnerabilities of women and girls. As the Pacific, and we are very prone to natural disasters, we need to be climate resilient. And we need to ensure that we are integrating social protection with adaptive social protection strategies. There's a lot of attention needed in terms of disability inclusion, not only providing social protection program for cash benefit, but designing programs to allow equal opportunity for economic empowerment and access to services. And overall, the need for comprehensive and contextualized programs to address the evolving social protection landscape in the Indo-Pacific. I think that's the contribution from Fiji.
Shirin, what about you?
Thanks, Joe. As Director Vermo clearly pointed out, if the Pacific was to lead on this, perhaps the direction would be inclusive social protection. I think in terms of new frontiers, I also see perhaps the inclusion of women in the economy and building the way towards women's economic empowerment through well-designed social protection programs is definitely there. Digitalization, definitely a new frontier, but I think a bit of a caution there is that wonderful as those tools are, there are at the end of the day only tools, and a digital solution or a technology solution is not a policy solution.
And finally, Karishma, over to you.
Thanks, Joe. My answer is probably a little bit of a combination of what Director Veremo and Shirin have also said. But I do really see governments prioritizing reforms focused on strengthening social protection delivery systems so that they can be as responsive as possible. So we're seeing a big push from governments to ensure that their existing programs are effectively reaching the right people and delivering payments to the right people and at the right times. And I think this is because governments are realizing that through their existing programs, they're already reaching a significant percentage of the population. They already have the building blocks in place for an effective shock responsive system. And what this means is that if all of this data on existing beneficiaries and their households, who they are, where they live, how to pay them, are actually housed in a digital solution or a management information system, then governments would have the ability to reach them efficiently and quickly when the next cyclone hit, for example. So we see our partner governments making a push towards investing in these types of systems while also ensuring that they are interoperable with other government data. In short, we see a push towards effective and efficient social protection system delivery that can be scaled up when the next emergency hits.
Thank you so much, Director Veremo, Shirin and Karishma, for this fantastic discussion today.
Thanks for having me, Joe, and it's a pleasure to be on this podcast, Naka.
Thanks, Joe. It was a pleasure to participate in this discussion and especially learn about what Fiji as another sister Pacific country is doing. So thank you so much.
Thanks so much, Joe. It was a real pleasure to be on this podcast.
Before we go, we like to end each episode with some quick wins. We ask our guests to bring in some recommendations for research, news, or events, anything that has sparked their interest and that we think you should know more about. Joining us for Quick Wins today is Lisa Hannigan, who is Senior Social Protection Specialist at Australia's Department of Foreign Affairs and Trade. Welcome, Lisa.
Thank you, Joe. Delighted to be here.
So when I asked you to bring in something that had sparked your interest, you actually came back with an experience, or maybe it was a kind of an aha moment. What was it that came to mind?
So I do have something that's sparking my interest at the moment. I was at last year's Global Forum on Adaptive Social Protection in Berlin, run by the German government and the World Bank. There were lots of interesting presentations and discussions, but the one thing that really resonated with me was a short comment during a Q&A session when measurement of results was being discussed. When a person, and I think they were from the OECD, they said, you can't measure dignity. Now, M&E experts might disagree. There definitely are ways to measure dignity, but I think his point stands. We don't generally seek to measure it. And for beneficiaries of social protection programs, who often have extremely hard lives, it's an essential consideration. And it could actually be the main benefit that a social protection program provides from their point of view. But also, if not designed well, it could serve to undermine dignity.
It's a really interesting point and perspective. So how do we see social protection contributing to people's dignity, do you think?
So, I think the reason the statement made in Berlin really resonated with me was because of some personal interactions in the field in the past where it was the dignity part of the social protection programs that most resonated with the beneficiaries. I just don't think we give it the weight it deserves. So two personal examples spring to mind. One was during an evaluation of the government's elderly pension in Uganda. We met lots of beneficiaries and they were doing some amazing things with their transfers. Goats were being raised, alcohol was being produced as a small business. But for these people, and for those who weren't quite as entrepreneurial, some of them were just using this sort of small transfer for consumption. And what was coming up again and again in the one-on-one discussions was that they valued the dignity that this conferred. One woman in particular had done really well with her goats. Then she'd branched out into chickens, and then she'd fixed up her house with a tin roof. She was able to help her grandson go to school in Kampala. But what she really reflected on was being able to make her own choices. She used to have to ask for donations from her grown children, and she'd have to ask for money if she needed any sort of simple basic necessities like soap. So now she loved the fact that as well as not having to rely on her kids, she had something to contribute. And she gave me an egg to take with me to have for dinner that night. And I was just so touched by that gesture, and I could see that it gave her such pleasure to give me something. And then another example quickly was just from Bangladesh. I was doing a review of BRACs targeting the ultra poor program. I was talking to a woman there who had been pretty ostracized by her community in the past. For her, the program had worked well. She could now feed her children more than once a day. They were going to school. There was regular income coming in. Yet when asked about the way the program had most impacted her life, she spoke about now she was asked to participate in community events because people now respected her. And it was that feeling she had of self-worth and respect that was the most important thing to her.
Those are such interesting reflections. And for me, it brought to mind an interesting paper, which I think came out last year from Ghana on the 1,000 Days LEAP program. And that paper found that women who received LEAP payments reported a perceived overall instrumental and emotional social support from their community. And in part, that appears to be, as you were just saying, because women felt they were all more able to engage in community activities and because they were able to make those small contributions when needed. And as you say, that's just so empowering and good for people's self-esteem. But more than that, it also ensures that they are able to participate in this informal support economy and draw on those reciprocal relationships at times of particular hardship. So the paper found that these kinds of social protection programs actually can crowd in different kinds of community support. We'll put a link to that study by Di Miliano et al. In the show notes. So coming back to you, if we were to foreground dignity in the way we think about social protection, what do you think that would mean, and what might change about the way programs are designed?
So I guess I'd like to see it as being a more central consideration. We'd want it to be given the weight it deserves in design, in implementation, in measurement. So basically just included in a more intentional, structured way. We want accessing social protection to be an empowering thing, not one that comes with any sense of shame. And this should also flow through to implementation. So, for example, when payment options for a new program are being considered, you'd not even consider an option, for example, that required people lining up in the hot sun behind a single ATM. Instead, you might stagger payment days or offer different payment options through different providers. And you'd make sure that you measured things like time spent picking up payments to ensure that people's time is being respected. So I guess it's just that sense of respect that you'd want to have at the core of it all.
Definitely some ideas to spark interest and reflection there. Thank you, Lisa Hannigan, for joining me on the Social Protection Podcast today.
Thank you, Jo. It was a privilege.
And thank you for joining us on the Social Protection Podcast. And a special thanks to our friends at Australia's Department of Foreign Affairs and Trade and the Partnerships for Social Protection program for inspiring this series and connecting us to guests. Don't forget to join us for the next episode when we'll look at improving social protection for gig and platform workers in Asia. We are a production of socialprotection.org. Follow us on Twitter at SP_gateway and find us on Facebook, YouTube and LinkedIn. Subscribe to this podcast via Apple Podcast or Spotify, and we love it when you leave a review. Back next month. See you then.